Question 1. Which of the following is the most common cause of heart failure? A. Hypertension. B. Hyperthyroidism. C. Diabetes mellitus. D. Chronic obstructive pulmonary disease, COPD. Correct answer, A. Hypertension. Question 2. What is the primary function of the atrioventricular, AV, node in the heart's electrical conduction system? A. Initiating each heartbeat. B. Transmitting electrical signals from the atria to the ventricles. C. Regulating blood pressure. D. Pumping oxygenated blood to the body. Correct answer, B. Transmitting electrical signals from the atria to the ventricles. Question 3. Which of the following cardiac enzymes is considered the most specific marker for myocardial infarction, heart attack? A. Troponin. B. Creatine kinase, CK. C. Myoglobin. D. Lactate dehydrogenase, LDH. Correct answer, A. Troponin. Question 4. What is the term for a condition in which the coronary arteries become narrowed or blocked, reducing blood flow to the heart muscle? A. Aneurysm. B. Arrhythmia. C. Atherosclerosis. D. Pericarditis. Correct answer, C. Atherosclerosis. Question 5. Which imaging technique is commonly used to assess the structure and function of the heart and its blood vessels? A. Magnetic resonance imaging, MRI. B. Positron emission tomography, PET. C. Computed tomography, CT, scan. D. X-ray. Correct answer, A. Magnetic resonance imaging, MRI. Question 6. Which heart valve disorder is characterized by the backward flow of blood from the left ventricle into the left atrium during systole, leading to symptoms such as fatigue and shortness of breath? A. Aortic stenosis. B. Mitral valve regurgitation. C. Tricuspid valve stenosis. D. Pulmonary valve atresia. Correct answer, B. Mitral valve regurgitation. Question 7. Which class of antiarrhythmic medications primarily blocks sodium channels in cardiac cells, thereby slowing conduction through the heart and often used to treat ventricular arrhythmias? A. Class 1. B. Class 2. C. Class 3. D. Class 4. Correct answer, A. Class 1. Question 8. In the context of heart failure, what term describes the condition in which the heart is unable to pump blood effectively due to its chambers becoming stiff and less compliant, often associated with conditions like hypertension and aging? A. Systolic heart failure. B. Diastolic heart failure. C. Congestive heart failure. D. Ischemic heart failure. Correct answer, B. Diastolic heart failure. Question 9. Which imaging technique is commonly used to evaluate coronary artery disease by injecting a contrast dye into the coronary arteries and capturing X-ray images to visualize any blockages or narrowing in the blood vessels? A. Echocardiogram. B. Cardiac catheterization, angiography. C. Stress test. D. Holter monitor. Correct answer, B. Cardiac catheterization, angiography. Question 10. What is the term for a surgical procedure that involves the removal and replacement of a damaged or diseased heart valve with either a mechanical or biological valve to restore proper cardiac function? A. Coronary artery bypass graft, CABG. B. Ablation therapy. C. Heart transplantation. D. Valve replacement surgery. Correct answer, D. Valve replacement surgery. Question 11. Which cardiac biomarker is released into the bloodstream following damage to the heart muscle and is often used in the diagnosis of acute myocardial infarction, heart attack? A. Creatine kinase, CK. B. Myoglobin. C. Troponin. D. Brain natriuretic peptide, BNP. Correct answer, C. Troponin. Question 12. What is the most common type of arrhythmia characterized by rapid, irregular electrical impulses in the atria, resulting in an irregular heartbeat and an increased risk of stroke? A. Atrial fibrillation. B. Ventricular tachycardia. C. Bradycardia. D. Supraventricular tachycardia. Correct answer, A. Atrial fibrillation. Question 13. What is the term for the condition in which the heart's electrical impulses originate from a location other than the sinoatrial, SA, node, causing irregular heartbeats and often requiring the use of an artificial pacemaker? A. Bradycardia. B. Tachycardia. C. Arrhythmia. D. Ectopic heartbeat. Correct answer, D. Ectopic heartbeat. Question 14. Which non-invasive diagnostic test measures the electrical activity of the heart over a period of time, typically 24 to 48 hours, to detect irregularities in heart rhythm and assess symptoms such as palpitations or dizziness? A. Echocardiogram. B. Cardiac catheterization. C. Electrocardiogram, ECG or EKG. D. Holter monitor. Correct answer, D. Holter monitor. Question 15. Which structural heart defect is characterized by an abnormal opening between the two upper chambers of the heart, the atria, often leading to symptoms like shortness of breath and an increased risk of stroke? A. Aortic stenosis. B. Ventricular septal defect, VSD. C. Atrial septal defect, ASD. D. Mitral valve regurgitation. Correct answer, C. Atrial septal defect, ASD. Question 16. Which medication class, commonly prescribed to reduce high blood pressure and protect the heart, works by blocking the effects of angiotensin II, a hormone that narrows blood vessels and raises blood pressure? A. Beta blockers. B. Diuretics. C. Calcium channel blockers. D. Angiotensin-converting enzyme, ACE, inhibitors. Correct answer, D. Angiotensin-converting enzyme, ACE, inhibitors. Question 17. What is the primary function of the right ventricle in the heart's circulation system? A. Pump oxygenated blood to the body. B. Pump deoxygenated blood to the lungs. C. Receive oxygenated blood from the pulmonary veins. D. Receive deoxygenated blood from the systemic veins. Correct answer, B. Pump deoxygenated blood to the lungs. Question 18. Which congenital heart defect involves a narrowing or constriction of the aorta just after it exits the left ventricle, leading to decreased blood flow to the body and often characterized by a heart murmur? A. Patent ductus arteriosus, PDA. B. Coarctation of the aorta, COA. C. Tetralogy of Fallot, TOF. D. Transposition of the great arteries, TGA. Correct answer, B. Coarctation of the aorta, COA. Question 19. What is the term for the condition in which a blood clot forms in a deep vein, usually in the legs, and can potentially travel to the lungs, causing a life-threatening condition? A. Myocardial infarction. B. Stroke. C. Deep vein thrombosis, DVT. D. Aneurysm. Correct answer, C. Deep vein thrombosis, DVT. Question 20. Which cardiac imaging technique uses a radioactive tracer to assess blood flow and identify areas of reduced blood supply to the heart muscle, aiding in the diagnosis of coronary artery disease? A. Magnetic resonance imaging, MRI. B. Computed tomography, CT, angiography. C. Positron emission tomography, PET, scan. D. Echocardiography. Correct answer, C. Positron emission tomography, PET, scan.